of nursing, and I'm also joined by Rhoda Redulla today. Rhoda, would you like to introduce yourself?
Yes, good day, everyone. I am Rhoda Redulla, and I am the Senior Director for Nursing Excellence in Magnet Recognition at New York Presbyterian.
Wonderful, thank you, Rhoda. And today, between us, we'll be talking about how to approach writing for publication. So, we'll each be talking about our own unique writing journeys and also thinking about this from different perspectives as well, from being, right from the early stages of our career, how we've developed our own personal writing styles and skills, and working across the board, both as a writer, peer reviewer, as well as editors as well. So, to get us started, I will share my writing journey with you all. So, my writing journey essentially started with my love of words and language. So, I grew up in a very multicultural environment where there were different languages that were used. And I think I've always been fascinated by the use of words and language, what that means within different contexts, how we translate different things, or the impossibilities of translating certain things that are culture bound. And so, I've always been really interested in reading and learning what words mean within different spaces and how we then develop our writing as a result. So my very first experience of writing for publication was through my undergraduate dissertation, and that was through some support from my dissertation supervisor at the time, which was absolutely vital to my career journey as a writer. And I wasn't expecting to publish or to be able to publish for my dissertation at all. So, for those of you who are on the call joining us as students and early career nurses and midwives, it's absolutely possible to publish right from the very beginning of your career journeys. As part of my role as a researcher, then, I think there's a responsibility as researchers to disseminate our work, whether that's through writing or presenting in other ways. And we'll be talking through some of the different areas that you might present your work and why writing is so important over the next few slides. I've also spoken previously as part of the Nursing Now Challenge as my role as a multidisciplinary researcher, so working in different spaces, both as a mental health nurse as well as having worked in sociology and social policy for a number of years. And working across different disciplines, I think, brings a whole unique perspective, not only in terms of working and learning in different ways, but also thinking about how we write in different ways as well. So, writing not only for different disciplines, but also for different audiences. And those writing styles really develop as we go along. So, thinking about how we really how we really shape our craft as writers, how we think about those different skill sets, those different audiences, whether it's patients, whether it's public, whether it's other healthcare professionals, or even more widely, and thinking about how we really engage audiences in those different spaces and make our writing really accessible. In terms of being a co-author as well, I think there's so much to learn in terms of being a co-author. I mentioned for my dissertation that it was my dissertation supervisor that supported me in writing for publication. But actually, through co authorship, there's that informal mentorship that happens as well. So, thinking about what we can learn from different authors in terms of their different approaches to writing and their different styles, but also thinking about what we have to offer in from our own personal perspectives and from our own areas of expertise and our own individual sense of writing as well. And I think that co authorship process can be really important because people approach writing in such different ways. We all have our own unique styles of thinking as well. And so co authoring papers means that there's different perspectives that all come together as one. So, some people, for example, when co authoring, there might be one person leading a paper with a team of people around them that then support and give feedback and comment in different ways. For other people, co authorship might be leading on different sections of the paper, for example, and working together in that way. So that collaboration process can be very different and experienced very differently depending on how people work and your own individual styles. I think it's also really helpful to be a peer reviewer. So a peer reviewer essentially reads and gives feedback on papers that are published for submission, for example, or it could be book chapters, or even informally reading other people's work to give that advice, feedback, and areas for development and improvement. And I think being a peer reviewer is important for several reasons. So I think being a peer reviewer gives you the opportunity to provide feedback to other people, but it also means that you're learning that process of how other people are writing and how other people develop a paper in the way that you can apply for your own writing as well. And I think in terms of giving feedback, it's also that aspect of almost mirroring. So thinking about what it would be like for you to receive that feedback. So not only giving feedback, but what it's like to receive feedback as well, because that's very different. It can be quite uncomfortable to receive that critical feedback, first of all. But actually, in having that skill set to deliver feedback effectively also means that you're learning about how to give effective and efficient feedback. So we talked about also being editors, Redulla and I, and so Rhoda and I. So we'll be talking about what it's like to be an editor and that process in more detail later on today. But I think being an editor gives us that experience to really think about the whole process from start to finish when we're submitting papers for publication. So what that process and what that journey entails. So thinking about why do we write to begin with? So, one of my early experiences in education, one of my teachers said to me, you don't really understand, you can't really demonstrate your understanding unless you can communicate it. So, in terms of writing, then, if we were to apply that principle to writing, it's then thinking about, well, how do we communicate our ideas? Have we really understood what we think we understand so that we can communicate effectively and to share that learning with other people? So, in terms of writing, it could be about communicating our different ideas. So, thinking about how we communicate effectively. How is writing different to communicating verbally, for example, or how might we communicate to different audiences for different purposes? It can be writing for clarity. So, thinking about how we write clearly, so how we write succinctly. So, in the modern day, we use so much technology and social media, for example. And sometimes we want to capture those really key, crucial points to our audiences. So, thinking about how we, for example, headline, what are the key messages that we want to get across? But also thinking about that clarity of detail as well. So, how we get across the core messages, but also how we write in more depth and detail for people who really want to understand the different ideas, the different intentions behind what we're writing. As nurses, we talk so often about the importance of reflection. So thinking about writing as a means to to really think about what we're feeling, what our thoughts and feelings are, and put that into paper to really think through things in more detail and potentially in a more structured way as well, so that we're problem solving as we're writing. It can also be about documenting. So as nurses, we often get told, actually, it hasn't happened unless it's written down. So that documentation becomes really important to really document what has happened in a really structured and formalised way. In terms of accountability, that can be part of our roles when we're thinking about documenting patient records, patient notes, for example. But one of my roles is I've also been invited to be a ghostwriter on numerous occasions for actually people in quite senior positions. And so through, ghostwriting, writing for other people, there has, I suppose, in a sense, been a bit of a tension because I think, as an academic, we gain our authorship through having our name attached to something. But actually, ghostwriting when you're writing for somebody else means that you're not credited with what you've written, but you're potentially also at the same time holding people to account by what they've said and what they've delivered. And so that can be another really important aspect of writing and communication. In terms of writing, you might also be sharing best practice. So, thinking about your personal areas of work, your personal areas of interest, and thinking about how you share those to good effect. It can be thinking about sharing how best practice might work within other areas, for example, so testing that knowledge, but also thinking about what new knowledge you're contributing in that space. And also thinking about how you might share influence and impact. And that comes back to thinking about who do you want your writing to reach? Who is your audience and how might you influence? And that then is thinking about where you might publish. And we'll talk about those things a bit later on today as well. So, in terms of what is worth publishing, there's so many different areas in which we can write and share our ideas, and these are just a few of them. So, in terms of writing for publication, you could write, for example, a blog. So, writing your thoughts in a way that's understandable and accessible. It could be a conceptual paper, so something that's more theoretical and theoretically driven. And it can also be something that's at the early stages. So, a conceptual paper could be something that's at the early stages of a study, for example, where you haven't even got the findings yet, but you're wanting to communicate to people that this is a piece of work that you're starting on. And all of these things are possible. You might also think about evaluation. So, is there a piece of work that you're currently working on in your current space where you're thinking about, well, has this worked well? Or if it hasn't, what might be done differently, or what might be done differently or even better, or what might you change? All of that forms part of that evaluation process, and that documenting becomes really important, not only for your own learning and documentation, but also thinking about how other people might learn from that work as well. It could be sharing your experiences. And we talked so much about the importance of patient and public involvement and inclusion, which includes people's lived experiences as well. So this could be sharing your own personal experiences of, a certain context or of something that's happened, within your workplace or even around your education, for example. Those experiences and those narratives become really important in terms of shaping what we might do differently, what we can learn from, and how we might then apply that to in different ways. It could be opinion pieces, so it could be writing a commentary on what you think about a certain thing, about a certain topic. It could be your reflections, I've already mentioned. It could be a research study, so thinking about the size or scale. It doesn't have to be a huge research study. It can be from your dissertations, it can be from some of the work that you're interested in doing right now, some of your research that you might have done on placements, for example, or within your current workplace. And that also includes quality improvement projects. So thinking about how you share that knowledge and really shape practice, education, policies, or future research. In terms of choosing the right journal, so choosing the right journal, I mentioned the importance of thinking through who you really want to influence, what do you want to impact, and what do you want to change. And choosing the right journal for your publication is really thinking about the fit. So, who do you want to reach? Who is your audience? Who's likely to read those journals? Do people have access to them? And also thinking about the discipline and profession, because each of the journals will be aligned to various different disciplines or professions, or they might be more of a multidisciplinary mix. So, thinking about your space within this work and also thinking about the author guidelines. So each journal will have their own set of author guidelines, and each journal will have then different things that they're more likely to accept based on those author guidelines, whether it's around the topic, whether it's around the discipline, the profession, and even word count. So word count becomes really important when you're trying to condense your ideas and thinking about, how long is the article that you want to write. And in terms of thinking through what is most, what would be the most beneficial for you, as in, do you want to write a longer paper? Is that really important to you? Or actually, is a shorter paper what you want to go for? And in that case, thinking about what would work best for you. In academia, we talk a lot about impact factor. And the impact factor tends to think about, the higher the ranking of an impact of a journal, the greater impact it has. But that also means that those journals are often more receive more submissions, and so can be a little bit trickier to publish in. So thinking about getting that right balance between having that really high impact, but also that pragmatic approach of, where your paper might be accepted. And so you might essentially go for, think about um, prioritizing which journals would be the best journal for you to publish in, but also potentially having those backup plans as well. And also thinking about special issues. So journals tend to also have calls for, specialist topics that they invite people to publish in. So if you are particularly interested in, specific topics, thinking about looking out for those special editions and thinking about whether that also might lend itself to, where you publish as well. When we think about the anatomy of a manuscript, so this is a very broad kind of overview of what a publication might look like. And there are parallels here between the anatomy of a manuscript and how you might write an essay for your studies, for example. And so those are really transferable skills between what we're expecting, in your assignments and at times, but also how you might then write, in the real world, as it were. So in terms of a manuscript, in terms of when you submit a paper for publication, journals often ask for an abstract to begin with. That's then followed by the different sections of the manuscript itself, so the introduction and background, aims and objectives, methodology and methods, findings, discussion, conclusion, and recommendations. And I'll talk through those in more detail over my next slides. So in terms of the abstract, this is usually between 250 and 300 words, so a really brief summary where you're really asked to give a condensed overview of your ideas. So putting these into context, thinking about, what are your real core messages here? What are your top level headlines in terms of your introduction, methods, findings, discussion, conclusions, and recommendations? And so these might just be a few sentences for each of these. So the abstract is offering that real summary of, the overarching themes and ideas that you really want to headline as part of your paper. And then you'll go into more detail in each of these sections within the main paper itself. So in the introduction and background, you're really offering that broader overview of why this topic is important. What is your focus? And why is this so important? So really problematising what are the core contemporary issues within this space and what are these knowledge gaps? And so by identifying those knowledge gaps, you're really then shaping and formulating what then are your aims and objectives. So these could be set out as your research questions. It could be set out as your research hypothesis, for example, but also giving a brief overview of what your plans and outcomes are. In terms of your methodology and methods, thinking about how you're going to approach this research, how you're going to approach this study, and why this is important. So I often talk about the importance of replication within research and thinking about, well, if somebody else was going to pick up this paper, theoretically, by outlining your methodology and methods, somebody else should be able to replicate what you've done. In terms of the findings, so when we find things, whether it's doing a literature review or whether it's doing a real whether it's doing a full research study, the themes and the ideas that you have are often messy, even though the order of things and the anatomy of a manuscript is very structured. In the real world, it's really messy. There's lots of ideas all over the place. And so your role as an author is trying to give structure. So providing that order, providing a really clear set of themes, and also outlining anything that is outlying. So anything that is novel, new, unexpected, all of those things become really important to really showcase as part of your findings section. And this is really showcasing what you found and what people have said about the topic. In terms of the discussion, This is where you really think about applying those findings to the wider context. So, on the one hand, thinking about the strengths and limitations of your study. So, what has worked well, what hasn't worked so well, what might be improved. But also then thinking about the relationship between the findings and what's been known already. So, thinking about how your findings relate to the literature. What have you found that is actually unique and new and novel? And also thinking about how your findings might either confirm what is already known or actually disrupt what is already known by providing a new perspective, new angle on things. Your conclusion then should offer those key messages around a summary of what you found and why this is important. So it should really offer a balanced view on, all the different things that you've talked about so far. So your conclusion would be a few statements on, on balance, what do you think? What are your thoughts around this topic now that you've reviewed all of this data? And then the recommendations then offer a few key statements about what is essentially your call to action. What do you want to influence and impact? Who are you calling to action these things? Whether it's people working within research, education, policy, or practice, or even more widely. So that is essentially a quick summary and an overview of what a manuscript might look like and how you might approach this as a starting point. And I'll pass over to Rhoda to share her journey as well. So I'll stop sharing my slides and hand over to Rhoda.
Thank you, Ada. It was so wonderful presentation of the nuts and bolts and aspects of an article and a publication. Thank you, and welcome again to those who just joined us. My name is Rhoda Redulla, and I am here to share with you what happens next after you completed your manuscript. And we had a very nice presentation there already by Dr. Ada Huey. So I will also share with you my journey. I has started my career. I was in the Philippines. I was born and raised in the Philippines and started my career there. So my introduction into writing started like Ada as a student. Later on, of course, doing my research work as a student. But my first work was in academia, and I worked very closely with our Office of Research and Planning in the university. And I was involved in research committees and eventually, partnering with other researchers in our university. Life brought us to the United States, so I'm now based here in New York. But when I started my career here, I already started working in a large academic center where I was working with a lot of physicians and colleagues who were involved in research and writing. And several of them were really encouraging me to write and to continue to be engaged in writing. So after writing and publishing that first clinical article that I that was that I worked on. It was really the beginning of many others. And like Dr. We here, I also participated as a peer reviewer. My clinical specialty is gastroenterology, although I am now work in a leadership role in Magnet, but I really started my journey in gastroenterology and continued on working in that realm in terms of research as well. So the Gastroenterology Nursing Journal, that's where I am associate editor now, and I've grown in that role after I published my first article there, and then published more. I was invited as a peer reviewer, and I cannot stress enough the lessons learned by being a peer reviewer. And by being a peer reviewer, you really become a better author. Um, After that, I was invited to be a part of the editorial board of the journal, and now I'm an associate editor. I also manage the Write Project. This is a writing for publication workshop that we conduct nationally, where participants come with an idea, and then we work through that idea within the next, within 8 months, from idea to outline to all the different parts of the paper to publication. And that's an every 2 month meeting. And they are also assigned a mentor. Aside from um, editing, my editing role in the journal, I also had an opportunity to publish my own book, and that's a book in professional development. That's what you see here on the screen. Fast Facts for Making the Most of Your Career in Nursing. And I can share with you these resources as well. I've been invited to write other publications to guide nurses to get started with writing. And you can see some of them here. These were published in American Nurse, the official journal of the American Nurses Association. Okay, so after you hit submit, so Ada gave us a very nice step-by-step presentation of why to write, what to write, and how to get there. So now you have your manuscript done, and you have reviewed it. You think you have already completed all the elements that is required by the journal. You have reviewed the author guidelines. So now you are getting ready to submit. Typically, when you submit in a journal, that you are required to create your account first. So I just want to make sure that I mentioned that. You create your account in the same as your, submitting an abstract, for example. You are creating an account, and then you will be getting a link where you can actually go back later to be able to revisit the track, you revisit or track the progress of your manuscript. So after you submit, what happens is there are some technical checks that happen on the other end on the journal side. They want to make sure first that you have submitted all the required attachments, and typically they ask you to fill out and sign a copyright agreement so that after your manuscript is accepted, they already have that in file. But anyway, then it goes to an initial review. First, they look at the journal looks at whether your topic is a right fit for the journal. And after that initial screening process, it goes if the editor or the editorial team thinks that it is a good fit, then it's sent out for peer review. Typically, there are two peer reviewers that are assigned to look at your work. They're independent, and sometimes most of the time it's blinded, but in some cases it may not be. But it is encouraged that it is blinded. Actually, it should be double blinded. They don't know, you don't, as the author, you don't know who's reviewing your paper, and the reviewer doesn't have information on who the author is. Um, and then the peer review process may take 6 to 8 weeks. So it's just really managing everyone's expectations, because it gets assigned. They're given about, like 4 weeks to look at it, and then it goes back to the journal, and then you are notified about the any revisions that's required, and then the decision, right? So, for the peer review process, I want to point out these areas: content, organization, and any figures, tables, or references that you are attaching. This is a great guide for you before you even submit the paper, to think that, yes, they're looking at the content for accuracy, credibility, and completeness, and how you are organizing your manuscript overall, how your ideas flow, and really, is it thoroughly checked and accurate? And the same way, the peer reviewers are looking at this. They are commenting on this, and they have question prompts that they are going through to review your submission or review each submission thoroughly. And some of those questions are here. For example, does the manuscript have relevance to nurses and clinicians? Of course, with the mindset that you are submitting to a nursing journal. Is the topic timely? And this is really important. And for example, I can share that a common question that we got in recent years is that um, this was probably up to last year, right? I did work during COVID. Can I still submit it, right? So that depends on what aspect are you featuring. So if I mentioned that if that was, of course, during the time of COVID, like 21 and 20, like 20, 21, 22, that was really a hot topic. But it may not be as interesting now. But if you are sharing some lessons that we can apply, and Ada shared this, touch on this later, apply some lessons that it can be replicated in other areas, then maybe, or if you are presenting something novel that we have not really seen much in the literature before. But you get it. Is the topic timely? That's one thing that will be a prompt that the reviewers will be responding to. Is the organization clear and logical? And they may advise you to move some paragraphs earlier, introduce some terms earlier in the manuscript, or just add more content to bridge ideas. Is the information developed in adequate depth? When I know that some of the common um, comments that I see sometimes is that yes, you add this bullet points that you are mentioning. Please add more, information, because sometimes it may just appear that some sections of the manuscript are outlines, right? Are illustrations, tables, and figures appropriate? And have you kept the manuscript interesting to read for the readers throughout? And lastly, is the title relevant and does it explain the topic? So these are just some of the things that the reviewers go through when they are reviewing your work. Um, so here are just some examples of comments from peer reviewers. They may say, well, it's generally well done. Limitations of the pre and post test design used were not explained. Literature were not completely cited, and they can add very specific details to that and actually make edits on the manuscript on what they have observed, and lack of information about the educational intervention. I remember reviewing a manuscript recently, and both the peer reviewers were so interested in the educational intervention. They were looking for the actual, what was taught, right? They describe it, but they wanted more of the educational intervention that was done, and that was what they put in the manuscript. I mentioned this to you earlier. A peer review can be an open review where identities of peer reviewer and authors are known to each other. It can be single blind or double blind. Single is identities of peer reviewers are not shared with the author, but more commonly in our nursing journals, it's double blinded, where neither reviewers or the authors know each other's identity, which really prompts an honest critique. When you submit a manuscript, it can be put into this different buckets. One is it could be accepted without revisions, like no other revisions. So I was asked that once, like, have you ever seen a manuscript like that? Um, Very rarely, but yes. And in the end, the editors will, if there are very, very minor tweaks, just because also it will take more time to go back and forth again with the author for the revisions. If it really is really well done, you get accepted right away. But most get revisions. Okay, so either minor revisions, major revisions, or they ask you to revise, but no guarantee of acceptance. I'm not sure if all journals have this category, but in my journal we do. Or it could be an outright, what we call a desk. There's like rejects too. There's a desk reject where just from the title itself, we already know it's not something that, from the title and abstract, we know that it's not something that will really be a good fit for the manuscript, for our journal, or a reject where after it went through peer review, peer reviewers and the editorial team um, deemed that the manuscript is not worth publishing within the journal. So, when I mentioned the desk rejected, that's important to know because it's really important to pay attention to the author guidelines and the guidelines of the journal and the objectives of the journal. Believe it or not, for example, in gastroenterology journal, we get submissions about obstetrics, right? Like, whoa, this is like a total error. Maybe they clicked the wrong journal or something, but that happens. Um, okay, so the revision process. So what happens when you get your manuscript back and you see all the recommendations? First, take a deep breath and take the time to read the entire comments from the editors and reviewers. Next, reflect, right? See what you think would be um, doable and like straight out that you can revise, you can work on them first. And for things that you do not understand, if there are areas of the review that you do not understand, you can engage a peer or you can engage a mentor to guide you in the revision. And if it still is not clear, it really is fine to reach out to the editor and seek clarification on what is being asked. That's not common because typically we make sure that the comments are clear, but there may be some misinterpretation on the side of the author, so we get a question, and that's okay. And so you go in and revise and rewrite it to the best that you can. Okay, so what you will be asked when you revise it is for you to address everything, right? So when you are submitting your revision, first you can, you write a short note thanking the reviewers and the editor for their review and for their comments, and address each comment with a clear response on what you did to change or revise the manuscript. And this is important, right? Have a clear distinction or highlight the changes that you made. Um, some journals may just ask you submit, an entirely new manuscript and then mark them on the manuscript, or but most journals will ask you to use the file that they gave you and make sure you are making the appropriate changes right there. You proofread and review your work, and then you are typically given a certain amount of time, whether it's, like 2 weeks or 30 days, make sure to submit it on time. Okay, so I will just mention here quickly, this is very important, ethics of publishing. It is really important that when you are starting to write a manuscript, in the planning stage of your manuscript, if you have a co-author or co-authors, establish the authorship right away. What do we mean by this? The order of authorship is very important, and we have clear guidelines from our um, uh, our Council of Publication Ethics on who is considered an author first, who is considered an author, and who can go into an acknowledgement section of the journal. So an author should have an active role in writing and revising the manuscript and to the actual work of really writing the journal. And in terms of establishing primary author, second author, third author, that should be very well established before you go deeper into the writing. Um, Declare any conflicts of interest. You will be prompted to do that when you submit to the journal. Make sure you are paying attention to confidentiality and privacy. For example, in case studies, right? Make sure that things are de-identified, and even if you de-identify a case, typically it is recommended that you seek permission because there may be in some cases, they may still be able to recognize the case from how similar it is to them. Um, Also, pay attention to plagiarism. Make sure you are citing your sources, and be cautious about salami slicing. What is salami slicing? It is copying sections here and sections there, and then voila, I have a paragraph, right? So make sure you are citing and rephrasing, paraphrasing, and presenting things in your own words if you are not referencing an author. And pay attention to the accuracy and make sure you are correcting any errors in your manuscript. Okay, so here you are now, I just have like some tips when you are submitting your manuscript. We already discussed some of this when we are doing the peer review process, but make sure that you are paying attention to the relevance of your topic, timelines, and the overall importance, the adequacy of your rationale, and the literature review. Is it appropriately covered? And in terms of the concepts that you are covering for the journal. Logical organization of ideas, we have discussed that, and congruence between the question or issues and conclusions. This is important. We can't tell you enough that sometimes we have the set of objectives here, but when you go to the conclusions, some of those objectives were not addressed, or there were some that are new that are appearing in the results section that were not mentioned earlier in the manuscript. And really being clear in the writing, being consistent in the writing. If you're using a term in the beginning, make sure you are, adhering to that to the end, so you're not leaving the writer or the readers wondering if you are still talking about the same concept or issue, and really adhering to the publisher's editorial style guide. Okay, so now your article is accepted for publication. Congratulations. So what happens next? You will still have work to do after your article is submitted. You will need to approve the acceptance that this is that you have accepted the publication of your manuscript, and then you will be given page proofs on how it will really appear in the journal. You will be asked to review your credentials, any final questions that they think needs to be clarified. You'll be asked to do all of that, and then it goes into production and finally publication. So from the time that you submit to actual publication, this may look actually shorter. In some journals, it's longer because there are so many submissions, right? You will be given a schedule on when your journal article will appear in the paper. So my last slide is just sharing with you two FAQs that I get. Like, so Rhoda, when do you write? I don't have the time to write, or how do I find the time to write? And these two authors here, do you recognize any of them? So one is Stephen King and the other is Mark Twain. Mark Twain wrote his masterpieces at the busiest times of his life. He had several growing kids, and often they were sick, and he really found the time to write. And Stephen King as well had written so many novels, but can share with you that he has written his work at, amidst crazy schedules. So my advice is find time to write, put that on your schedule, put that on your diary or calendar. Put it as a regular schedule that you have to do. For me, I write best in either early morning or later in the evening. So I make sure I put that as I factor that in when I write. When and where to write, a pointer that I've read as well is any time that you have to wait is the time to write. You're waiting at the doctor's office, you have a long travel, make sure you have your notes handy, and it doesn't mean that you're writing pages and pages in one sitting, right? It can be just a paragraph or you're developing your outline, and be creative. And it will come to you as soon as you get into that habit. And that concludes my presentation. And we have time for questions.
Well, thank you so much, Rhoda. For anybody who does have questions, please do type them into the chat box. Rhoda, as you've been presenting, we have had a few questions around the size and scale of studies, and I've been replying in some of the chats, but I'd be really keen to hear your thoughts as well on what is too small to publish.
You want to take that, Ada, and I can add as well. I don't, or I will just jump right in. I think there's nothing that's too small to publish. There's a lot of options actually. So you saw Ada earlier share those options. One thing that comes up right away is we have columns in journals, and usually they have shorter um, word counts. I would say shorter. They can run in like 4 pages, double space. That's 1,200 words. And each journal can even have probably like a little bit less than that. But that's one example that I can think about right away. Ada.
Yes, thank you, Rhoda. And yeah, my response was very similar in the sense of thinking through, the even with really small scale studies, thinking about, well, what might be the more local journals? So the journals that might be, for example, located within the country in which the work took place, because there's, your more local journals in comparison with the international journals. So I think sometimes that can also shape or influence where people publish as well. But I think the important thing for me is to encourage everyone who's interested in writing to have a go and to write and submit as soon as possible, because that data will only get older, the longer that you leave it. And so the sooner that you write and submit that work, the more contemporary that will be.
Right. And
We've
start with what you know. That's one key thing, right? We in this room, we're all experts of one thing. Start with what you know best.
Brilliant. Thank you, Rhoda. We've also just had a further question come in. So what are legitimate ways of including AI or using AI in our manuscript?
AI is definitely an important and hot topic. I would say different journals have different guidelines around this, but I I can say that if you are using AI, you are asked to declare how you used it. And I would say, minimal use is is the guideline. Um, I'm just thinking how I don't know how what would be like the most legitimate way to use it, but maybe one would be checking for well grammar. Grammar might be one way that's commonly used for AI. That's what I have encountered. Um, and maybe checking for any additional ideas that you have not covered, but making sure that you are citing appropriate sources. You are just getting that as an idea and not actually taking that verbatim from AI sources. Because I can tell you that those may not be accurate. Oh,
Coming in quite quickly now, so bear with me a moment while I read these out. So there's one question that's, are there recommendations for low-cost journals where individuals in low-income countries can publish, since it can cost a lot to publish in some journals?
I I think we need to make clear or differentiate what it means to have an open access publication versus regular publication. So first, most publications, I mean, like our established publications do not require a fee for you to publish. But there is an option to do an open access journal where it is still a scholarly publication model that makes research articles freely available online immediately upon publication. And this funding model actually came up because of there are government funded researches in other countries or in most countries, and the expectation is for that work to be disseminated to the public. And so this model has evolved, right? Unfortunately, it also triggered the birth of what we call predatory journals, and you have to caution yourself against the predatory journals. Predatory are those illegitimate, like not non-legitimate publications where they're requiring fees and they're not really established scholarly journals. And not only publications, but there are also predatory conferences where they ask you to pay to be able to submit an abstract. And when you get there, they tell you, well, it's too good to be true, right? They tell you, submit your abstract and you'll get your acceptance in a week. When it sounds too good to be true, it really is not, be cautious about it. So going back to the question, there's no cost to submit, but they will ask you, every journal will ask you, do you want to submit it as open access? And that's when it requires a fee.
Thank you so much, Rhoda. So a couple more questions. So can we submit posters for conference presentations and then later publish the full article in a journal, or can we not do that? So I think it's absolutely fine to submit posters for conference presentations, and then submit the full article. And actually, by submitting posters to conferences, when you're presenting your conference to different audiences, I think sometimes that's when you can find, not only does it offer a really great opportunity to share your thoughts and ideas, but when people ask you questions, that might also help shape your thinking around developing your poster into a publication as well. So that can actually be really helpful. And particularly if you're thinking about building and developing your work into larger scale studies, for example, by showcasing and having those conversations with people, you might also be drawn into those wider research studies on those topics and be offered new and different opportunities as well. So I think any opportunity that you can go to showcase your work, that would be great. I realise the second part of that question is related specifically to RCN. So the question is, what kind of research mentorship and support can we have at the RCN, except for accessing the library, because that's already a resource that's used. And in terms of working in publishing research, what can the RCN offer to support members? So the RCN is a really interesting space in that sense because we've got our professional body, we've got our trade union, we've got the RCN Foundation, which is our charity arm, but we've also got the RCNI, which is essentially the RCN's publishing house. So for anybody who is interested in publishing, particularly via the RCN, we've got a whole suite of journals, that cater to a variety of audiences, right through from our research journal to, our other nursing journals that are very much specific to the nursing profession. But also have different purposes, and that might be actually a really good way to start because there's various RCNI journals that are around blogs, that are kind of more easily accessible, and so they are catered very much towards people during the earlier career stages in many ways. So I'll put my contact details into the chat so you can contact me and I can signpost you to various editors who work on the RCNI journals if that would be helpful. Um, so I think that's all of our questions that I can see for now. There's lots of thank yous in the chat. So thank you all so much for joining us today. Rhoda, did you have any final thoughts before we close?
I think you are asking all the important questions, and this has really been great. We hope we were able to inspire you to write that next article. I will also write my email here for any questions.
Wonderful. Thank you so much, everybody, for joining us today. And again, a huge thank you to Hannah as well, who works tirelessly in the background and being
Yes.
behind the scenes to make these webinars happen. So we very much look forward to seeing you all as authors very shortly, and we look forward to seeing your publications as you develop your writing. Thank you so
Yeah.
much, everyone.
Happy International Nurses Week and extended day.
Thank you, everyone. Bye for now.
Bye.